you all for coming. We're so glad that you're here. This is our first ever career panel at the Forrest Institute that I know of. Dr. Powers would know better. Okay. So just real quick, I'm going to introduce our panel and I'm going to let them do the talking. But again, welcome to the Forrest Institute. If you don't know much about us, we are a private, nonprofit school of professional psychology. We have 4 master's programs and a doctorate. So we have a master's in clinical psychology, a master's in counseling psychology, a master's in marriage and family therapy, and a master's in applied behavior analysis. And then our doctorate is a Psy.D, and we have different concentrations that go along with that as well. So one of the main reasons that people come to Forrest from all over the country and all over the world is because our faculty are experts in the field and they have different areas of interest. And so we thought it would be really interesting to invite the public and our community here at Forrest to come and hear from them why they chose their particular area and kind of what they've done in their career. So this is just a very informal discussion, and we'll have time for questions. And then afterwards, if anybody's interested in seeing our campus, we can show it to you. We do have a freestanding clinic, which is on South Campbell. It is a training facility, and a lot of our faculty practice there, our supervised students there. So other than that, everything is here in this main campus. We have a second location in St. Louis. But I'm going to turn it over to our faculty and let them kind of introduce themselves and say whatever you want to say about your career. So, who wants to start?
I'll start.
Okay.
Welcome, everyone. Working all right? All right. My voice is kind of, maybe it's a tie.
It probably is.
Well, my name's Dr. Brad Powers. Where to start? I went to school in Nebraska originally at a small college in Nebraska called Kearney State College, and then turned to the University of Nebraska at Kearney. I got my bachelor's in comprehensive psych and with an emphasis in criminal justice, and that kind of shed some light on where I headed. Then I came down here in '91 and attended Forrest myself. Went out and practiced for a few years after I got my doctorate here for the Sheriff's Department in working in the jail as the first mental health coordinator. Left that position in 2000 and was getting ready to go into private practice, and I've been doing some private practice on the side while I was working there. And the school asked me to come back and be a professor, so I said, oh, that's an interesting, something I hadn't thought about doing, but said, yeah, why not? Stay in the area, don't have to move. And I can still do private practice, so I did some of that. What have we done? What have I done? I started out inpatient working, not as a patient, but some would probably guess otherwise. Working in an inpatient setting with children and adolescents, and children all the way down to 5, and some substance abuse as well as part of my master's program, and some marriage and family therapy. So I got a good start in my bachelor's and master's program with a lot of exposure to the inpatient population. So when I came to Forrest, one of the things that I knew from Forrest was that they offered a lot of different emphasis areas, and one of the things that I was interested in at the time was the child and adolescent. So when I came here, I thought, oh, okay, I'll take some of those classes. Well, they had it set up so that you could take classes in other areas. So I thought, oh, these neuropsych classes, that really is an interesting thing, how the brain works. And so I took all of those classes and was going to do neuropsychology instead. Halfway through my residency year, my supervisor said to me, you're going to jail. So I went to the jail and worked corrections, and really got interested in suicides and suicide prevention at the time. When I came to Forrest to teach, picked up a lot more skill sets in the suicide, so I'd say that as far as one of my primary skill sets is suicide detection intervention. But I also got real interested in the forensic side as well, so started doing some forensic evals, picked up a contract in law enforcement, working with law enforcement, doing pre-employment, fitness for duty, working with as a consultant, doing training with them. And then a couple of years ago, I decided I needed another focus area, so I got involved in primary care psychology and got certified in that a couple of years ago. And so, I think my story is, as far as what your interests are in the field, or where you go, if you're a student, Forest provides a platform that allows you to take classes in a lot of different areas, and the field allows you to get retrained even once you're graduated, but it gives you a solid base. So I went from child and adolescent to adult outpatient to corrections to police psychology, now primary care psychology. So there's a lot of options that can come out of your degrees.
Hi, I am Dr. Michele Williams. I graduated from here locally at Drury University with a bachelor's in psychology and a minor in biology. And then I went to graduate school in behavior analysis at West Virginia University, and I got my master's and Ph.D. there. I was a rat runner. I did learning research with rats and pigeons and Siamese fighting fish on basic learning principles, a la B.F. Skinner, if you've ever heard of him. And after graduation, I went to Atlanta, Georgia for a postdoctoral fellowship in behavioral pharmacology. And I was still working with rats, but this time I was giving different drugs to see the influence on their behavior. It was the Mercer Southern School of Pharmacy in Atlanta, Georgia. I was planning on staying in that route and staying in academia, but I took a position as a professor at Anderson College in Anderson, South Carolina, that was being vacated by one of my fellow graduate students from West Virginia, and she was leaving to work with children with autism after having gone to UCLA to train with Ivar Lovaas in applied behavior analysis. So I thought that was kind of interesting because she had the same training as me. So she started a clinic and I started working with her and found out that, lo and behold, it really is true that the learning principles we studied in the lab work the same for individuals out in the real world, including children with autism. So my career kind of took a different path, and I started working as a behavior consultant. I moved back home to Southwest Missouri, and I started seeing clients with autism spectrum disorders. Generally, these were children younger than 10. Most of my cases, though, were under 5. 3 to 5 is kind of the hot spot for this kind of therapy with children with autism. And I designed in-home ABA programs. I trained the therapists to work with the children on a one-on-one basis. I worked with teachers and trained them on how to handle the behaviors in the classroom. I think that's about it, mostly teachers and parents and working with the children. And I found that after 2 or 3 years of ABA, many of those children no longer required my services. They were able to go into regular school settings, regular classrooms without any further assistance. And so I saw with my own eyes how important and effective that therapy can be. And it's been gaining ground since 1993. People have known this and been doing applied behavior analysis for kids with autism. But more recently, you're finding that states are starting to wake up and require insurance coverage for this type of therapy. Missouri passed a law in January 2011. It went into effect that ABA therapy has to be covered by private insurers in the state of Missouri, and there are probably about half the states that have similar laws. So what that has meant is that there's a much bigger need for people who are board certified behavior analysts and licensed behavior analysts, as I am. And so I no longer practice. I prefer to be back in academia and teaching the people who are going to be out there and getting certified and licensed and practicing. But I guess I've found that there's no shortage of need, both here and in St. Louis. I have programs in both locations. We have many different practicum sites where the students can work with children in schools as well as adults with developmental disabilities, and in school settings as well as in-home or clinic-based programs. So that is the focus of our program. It's applied behavior analysis, but most of the people who graduate with either certificates or with a master's in applied behavior analysis are looking to work with the autism spectrum disorders population at some point, whether it's childhood or adulthood. And I think that's all I have to say for now, so I'll pass it on.
Hi, I'm Dr. Ginger Holczer, and I started out in Michigan, at the University of Michigan, and did some of my undergrad there, ended up coming to Joplin and finishing up at Missouri Southern. Came to Forest and did my doctorate, and got out into practice. I first did a residency with abused kids, and spent 4 years doing that. And after I left that residency, I just was kind of, I guess you'd call it a garden variety kind of psychologist for a while. And during the time when I was in practice, I kind of started realizing that sexual issues came up a lot in therapy, especially if I asked the questions. If I asked somebody if they had sexual concerns or something like that during the intake, very often they would say yes. Well, at some point, I didn't have enough information to deal with what they were bringing up to me, and so I became certified as a sex therapist through ASECT, and have been doing that ever since. I kind of wondered about doing sex therapy in the Midwest, and what, you know, if I was even going to have business. I see all different sorts of people. I get way more calls than I can handle, to be honest. I get tons of calls. I see people with fetishes. I see people regarding sexual orientation, gender identity, people with sexual disorders, desire disorders, erection disorders, things like that, that might be more psychological than they are medical. The thing that really got me interested, I think, was just that the subject kept coming up, and I didn't have the answers, and started realizing there were only 14 at the time sex therapists in the state of Missouri. There's only 15 now. So we're few and far between. During that time that I was figuring all that out and being certified, a colleague of mine and myself, we started talking about the fact that people weren't talking to us about sex, they weren't talking to their physicians about sex, and they weren't talking to their partners about sex. And so we went to Barnes & Noble and sat on the floor and pulled books out of the shelves, every book about sex that we could find, and realized there's not even a book for it on how to talk about sex, so we wrote the book. It's called Finding and Revealing Your Sexual Self. So we did that. I do a lot of speaking in town regarding sexuality. I also teach human sexuality at Jury. And about 2 months ago, I came on here as the program director for the master's program in counseling psychology, which is kind of geared towards a non-traditional kind of student that might have to work, or maybe has other responsibilities that keep them from going to a full-time program. So, am I forgetting anything? I think that's it, so I'm going to pass it on.
Good evening. My name is Dr. Kristina Brown, and I'm a licensed marital and family therapist. I'm also the director here at Forest of our marriage and family therapy program. We offer a master's degree and a postgraduate degree certificate for someone who might have done a different mental health program and would like to get specialized in MFT, marriage and family therapy. I did my bachelor's at the University of Colorado in Boulder, and my degrees were in English and women's studies because I didn't have any clue what I wanted to do at that point. And then a couple years later, I returned to school at the University of San Diego to do my master's in marriage and family therapy. And then when my youngest child started back to kindergarten, I went to Syracuse University, so I went all the way to the other side of the U.S. and began pursuing my doctorate in marriage and family therapy from Syracuse University. And in 2007, I came here to Forest as a full-time core faculty, and I've been the program director for the last 3 years. Some of my clinical experience, I think a lot of people believe that marriage and family therapists only see couples and families. And if I reflect on sort of 15 years of practicing as a clinician, about 50% of my caseload typically is individuals. But they tend to be then presenting with issues that are in the realm of relationship and family problems, including divorce, infidelity, parenting issues, I want to kill my child, that kind of thing, not literally, though I am a mandated reporter, as we all are. So I've had a variety of experience within MFT, including doing some in-home therapy in New York with parents who had a mental health diagnosis, typically an Axis 2, which would be a personality disorder, and their children in the home. I've also worked in a substance abuse hospital, and right now I'm in private practice. I do a part-time private practice at Midwest Assessment and Psychotherapy Solutions, which is just down the road. Here at Forest, like I said, I'm the director of the program. So I teach our courses. I also supervise at our clinic. I'm an AAMFT approved supervisor. That's the American Association of Marriage and Family Therapy approved supervisor, and that's important because we are the only accredited master's and postgraduate degree program in the state of Missouri. And accreditation is really important in the field of MFT because it really makes your license transportable. So for example, if one of my graduates, just recently finished and moved to Kansas to work on her license, and basically the application says if you got a degree from an accredited institution, skip like 3 sections because you don't have to fill it out because they already know we're accountable to a national organization about our curriculum and our practicum and our faculty and staff who work in our program. So my areas of interest clinically and research-wise focused on medical issues. So I have a lot of couples and families that I see where one has an acute, terminal, or chronic illness, whether that's cancer diagnoses or chronic illnesses like endometriosis, which is a women's health issue, which is another area of specialty for me. I do a lot of specific couple issues, infidelity, divorce. Those are sort of hot topics in my private practice right now. So I guess we can, we just spewed at you for about 20 minutes and told you all about ourselves. So if you'd like to ask us some questions, and if you have a specific person that you have some questions for, you can let me know and I'll just pass the mic to them, or we can field more general questions among the 4 of us.
I've got a question for Dr. Powers. You spoke earlier about being certified in primary care. Could you give me an idea of what that process entailed?
Well, you have a core set of courses just like you have for your doctorate, and then the University of Massachusetts School of Medicine has a program that's, that you take, and take all the classes that they offer online, and then they issue a certificate.
About how long does that take? Can you give me an idea?
Their certificate, it was like a 6-week.
6 weeks, I think,
okay.
yeah.
I also participated in that, being a medical family therapist. And, medical family therapy is a relatively new field. There's only 9 institutions granting degrees across the United States right now, and so primary care psychology and medical family therapy are really hot topic issues, especially with all the insurance changes coming up. In my opinion, it's a great wave to ride on right now. So.
I go to MSU and I'm majoring in psychology, and I'd like to be a clinical psychologist and go to grad school and all that. What would be the best minor to do that and for the interest that I'm in?
I think that you want to make sure that you're, where the schools that you want to apply for graduate school, I would check to see what their prerequisite requirements are. I think a minor is important, but most important, and I can defer this question to Kim too, as the Director of Admissions, is to make sure that you're taking the courses we require as prerequisites for each of the specific programs, which differ slightly. There's some overlap, but each of us sort of have different requirements on that. I did a bachelor's in English, and here I am, 20 years later. So, but a lot of people do know what they want to do. So,
Being at Forest the past 13 years and watching the admission process and looking at students coming in out of their bachelor's programs, the areas that if I could tell students, preemptively say, go take these courses, take as many of these courses as you can, it would be in biology and in statistics, research design, psychometrics. Because those seem to be the areas that students, when they come in, probably struggle the most. So if you have a good solid base coming in, and I think one of those is still a requirement, isn't it? Yeah.
We require abnormal psychology, developmental psychology, and a biology course for the clinical program.
so that's for the clinical Psy.D program, but each of our programs is a little different.
I think any kind of technical writing class you can take too is really important because there's a lot of writing.
Mm-hmm.
Good question.
No question. No one
You can't ask questions.
Well, I'm just curious. I've known all of you for a little while, and know a lot about your careers. Do you have any plans to do anything else?
Vacation.
Take a vacation?
I was just going to say travel the world.
Yeah.
I think when you get into any of our areas, the degree is just the beginning. And it allows you that opportunity to continue to study and to continue to learn and to continue to stay in newer developing areas or fields that are coming out and with healthcare changes and even government changes on policies and insurance. And I think Forest does a really good job of staying out in front of the new areas and trying to integrate those into our programs so that students get exposure to that, and whether it be an ABA or MFT or just in the clinical programs in general. So we really look at the national scene and try to stay on top of it so that our students have some exposure coming out of what the important issues and topics are that they need to stay current with.
I think I definitely have vacation plans on the line. But I think when I did my master's program and my doctorate program a little bit separately, and I did my master's because I wanted to be a clinician, and I went on to do my master's or my doctorate degree because I wanted to go into academia, and I didn't know before I started that I would love research, and so we are a clinically focused program here at Forest, and so one of the ways that I get to do some research is through my students when they have to work on their thesis and their doctoral projects, and I really enjoy that. Right now I'm working on some encyclopedia entries, which sounds funny because I remember using the Junior Britannica when I was a kid for studies, but I've been working on with some students. We just submitted one on abortion attitudes, on menopause, on the country of Germany in the context of family studies, and so those are some neat projects that I've been working on with students right now and submitting those. So.
I have a question. I'm interested in forensic psychology, and what would be some good classes I could take to prepare myself in high school?
In high school,
Criminology.
yeah, that's going to be tough because I know my son's a junior in high school right now, and his course sequences are pretty set, and I don't see a lot of forensic psychology or, just getting a general psych course, or if they offer any, if you have the option to go over to OTC and take any classes, if you can take anything in criminology or forensic psychology that is a general first level class, just to kind of get some exposure. And probably the thing that I would tell you to do is, if you're really interested in the field, is to go find someone to talk to that's in the field and compare what you want to do right now to kind of what the field allows you to do and what kind of degree you would need, because there are people that testify in court that have bachelor's and master's degrees. So if you're recognized by the court as an expert because of your training and your experience, you don't necessarily have to have a lot of degrees to do that. So, and it just depends on what area, if it's a child custody thing, if it's a competency issue, and the different type of training and the different type of exposure that you would need to do what you want to do. And that's the tough thing, is that just when you think you know what you want to do, I'm a perfect example. I thought I was for sure going to work with children and adolescents, and I don't think I've even seen a kid or an adolescent in therapy for 20 plus years. So
what program would the forensics fall under here?
the doctoral program,
Really?
yeah.
It's an area of specialization within the doctorate in clinical psychology.
I received a suggestion recently from a clinical psychologist who said that receiving your doctorate in clinical psychology is no longer as necessary because licensed professional counselors can often see the same kind of clients and can do the same kind of general things. Can any of you speak to that, the pros and cons of maybe getting a master's in counseling versus a doctorate in clinical?
It's all you.
You want to throw something in there?
Well, it's kind of a loaded question for me because I have a doctorate, but I'm also the program director for the master's program, for one of the master's programs. I think it just depends on what you want to do, and to what degree you want to do it. If you were interested in doing evaluations and things like that, you would have to have a doctorate. There are a few things that definitely give you an advantage with a doctorate. But, with managed healthcare and things like that, sometimes a master's is the way to go, and I think it just depends on what it is that you want to do ultimately. So,
I think that some of our students pursue the doctorate because they want to be called doctor. And so I think you need to really think about, because it's a big investment in your future and what you want to do. But I agree with Dr. Holczer that you have to think about what you want to actually do and then find the path that gets you there. So like I was a perfectly happy master's level licensed clinician with my master's in marriage and family therapy, but I wanted to teach, and to teach in a graduate program I needed to have the highest terminal degree in my field, which was a Ph.D. in marriage and family therapy. But I didn't know that for 5 or 6 years after practicing. So you can go back. You don't have to do it all in one shot. You can figure out, because often I find our students who come here, they don't know what they don't know. And boy, they learn about all the options and opportunities that we offer. They think they want to come in for, one thing, and we open their minds or give them opportunities to experience and try out different things. And that's what graduate school is about. I have students who are like, oh, I didn't really want to see that population. Well, try it out here, why not? I used to love working with kids. I'm like with Dr. Powers, I don't see kids younger than my own. I have a 15 and 16-year-old, and 15 is my cutoff in therapy. I don't want to see anyone younger than that, so.
Another thing that you kind of tap into an area right now that if you'd asked us the same question 20 years ago, we'd have said, absolutely get your doctorate. But the way the field has changed and the opportunities for master's level clinicians, psychologists in general have not done a good job positioning themselves politically, have been very good advocates for their skill sets, their knowledge, their training. Master's level clinicians, social workers have all done an exceptional job of getting into state government and making pushes for being able to bill very similar to psychologists. So I don't see that trend changing anytime soon. So, you know, if you think that you're going to want to do mainly therapy, then financially it's probably a better decision to get your master's and to work in the field and do therapy. If you want to do assessments, then you're going to have additional training to have be recognized by the state to be able to do that. So, but that's a tough area. I mean, that's a tough decision to make interpersonally, to go, what, you know, do I want to limit myself to just therapy, or do I want to be able to do other types of things? So,
It's a very personal decision.
yeah, it is. It's a really tough thing, but you know, I probably shouldn't say this, but most of the time I try to talk people out of it if they're unsure. You know, if there is even a hesitation that you know, I'd rather just work and do therapy than if they come for their doctoral degree interview, I'm going to say to them, are you sure? You know, don't jump into this if you've got hesitation about it. So.
Even some of our certifications can be done with a master's degree. I know the certification through ASECT, where I am certified, can be done with a master's degree, and I believe with marriage and family as well.
So our postgraduate degree certificate is licensable in the state of Missouri, and that can be done with a master's degree.
So you all have degrees that are very, they open a lot of opportunities. So I guess my question is for you is, how easy is it to switch tracks if you wanted to, I guess?
I wanted to say something because I have students who come to Forest to get the master's in ABA. I have students who come to Forest because they've already got a degree or a bachelor's and they want to get certified in ABA. And I also have students from Forest programs who take the ABA courses because they want to be certified applied behavior analysts. So I've had, I think, 3 students from the Psy.D program taking ABA coursework and getting the certificate in their final year before they go on internship in the Psy.D program. And I've had students who graduated, a couple of students who graduated from the Master's in Clinical Terminal program and also wanted to get certified. So I think for them, they're looking at being able to practice as a psychologist and as a behavior analyst, which has some benefits. You don't find a lot of board certified behavior analysts who have the ability to practice in both fields because they're actually pretty different. But I think they're trying to maximize their, you know, available, I guess, clients. And really, it's not necessary because if you want to be a behavior analyst, you can be a behavior analyst. There's enough work out there. I get job solicitations a couple of times a week, literally, for jobs all over the country. There's just not enough people practicing behavior analysis. But if you're interested in doing psychology as well as behavior analysis, then there's that option.
As a licensed clinician, part of my ethics code that I'm responsible to says that I need to practice within the realm of my training and my specialization. So if I want to do something else, then I need to pursue the requisite training courses and that kind of thing in order to become certified. I also did the certificate in the primary care psychology like Dr. Powers did, you know, and then when I go to conferences, like I'm going to the American Association of Marriage and Family Therapy Conference in 2 weeks in Portland, Oregon, I'll choose specific courses and trainings along the lines of things that interest me clinically, research-wise. I'm teaching the MFT ethics course right now, so I'll probably take some ethics seminars. So I'm just making sure that I'm doing what I'm saying I'm doing and saying what I'm doing, you know, representing myself. It ticks me off to no end to be here in Springfield and see advertising for marriage counseling and take a look at those people's credentials, and they are not marriage and family therapists. You know, I think that you need specific training to do the things that you advertise and say what you do. So.
sure how this kind of applies, but I am a teacher. I have my bachelor's in elementary education, and I'm going to MSU right now working on my master's in school counseling. And I'm interested in the ABA as well, but would that have to be something like I would have to pursue a master's in ABA, or is there a way to just do the certificate, or how does that work?
Great question. I actually currently have a student who got her master's in school counseling too, and she's taking the certificate courses. We offer 2 certificate tracks, and for the BCBA certificate, you have to be a master's or higher. But they allow anyone to have their master's in either education or psychology, and then to be able, once you have that master's, you also have to take the required coursework, which we offer. We're approved by the Behavior Analyst Certification Board. We're an approved course sequence, which means that we offer all the education necessary. And we also have an approved, BACB approved intensive practicum. So in addition to your master's, which you're taking care of, you would have to have the required coursework, which we offer, and you'd also have to have the necessary experience. And then once you have those 3 components, you can sit for the certification exam that's given by the Behavior Analyst Certification Board. So you would be looking at 18 courses in the BCBA course sequence, which is done in the fall and spring, and then getting your experience either through us as a practicum course. We offer the intensive practicum, which means we satisfy all the experience requirements in half the hours of doing it outside of a university program. So you could get all of your experience in 3 practicum courses, 3 semesters, which would be 750 hours of experience, versus if you are getting it from a local BCBA who's providing the supervision, you would have to get 1,500 hours of experience. So you're still looking at a bit more to do, but school counseling is just fine as a master's requirement. You just have to get those ABA courses and experience.
To what extent has the DSM-5 changed the way that you practice psychology and the way you teach it and that?
Well, it's
aspect?
a real pain teaching it. Trying to figure out, how much of the DSM-4 TR we still need to know at this point. So yeah, it's kind of a pain to teach. But as far as practice, there's really not, so far, it's still, we're still billing with 5-axis system. So it's not really affected that at this point. There's not really a lot of change other than when you think about the autism spectrum disorders. And there's the gender identity disorder. Those are the 2 really controversial issues with the DSM-5. So far, I'm not seeing a big change in anything really.
I agree. I think that we're still billing under the 5-axis, and I think we just added a statement on our electronic medical record that these diagnoses are according to the DSM-4. And I think when we switch, we just have to make that statement so your insurance companies, your your payers know where you're billing under.
My students would say they have to learn both. Because until October 14, or October 5th of 14, the ICD-10 codes will then be put into place. So you're going to see some changes in the DSM-5 to a new TR or whatever they...
And who knows what we're going to end up with.
Licensing exams starting in 2014 will be testing on the DSM-5. So that's why we're sort of in this interesting straddle of, what do we offer our students, because practice right now is in the DSM-4, but they need to be prepared to be tested on the DSM-5.
Did you buy it?
Yes.
I just got mine. I'm really excited about it.
There's 365 diagnoses, one for every day of the
It's pretty in purple.
765 pages.
It's small.
It's a light read.
Easier to carry.
It's a light read. I'm taking it on vacation.
Yeah, if you want to fall asleep.
Yeah.
Yeah.
I haven't got my tabs yet. I'm a little sad. They haven't come in the mail.
Good question.
For those of you who don't know what the DSM is, it's the Diagnostic Statistical Manual.
Of mental disorders.
Thank you. And basically, it's the Bible, where when I see a client, I need to figure out what's going on with them, and it gives me a nice little nifty number I get to send to the insurance company, and I get paid. Short and sweet. I don't know if you want to elaborate.
It's a pretty important book.
Yeah, it is.
It shouldn't change a whole lot because a lot of the criteria that you look for symptom-wise that people experience have to be, they're very similar as far as what you would need to diagnose someone with a specific illness, so it hasn't changed a lot that way.
If I think about it in the context of marriage and family therapy, it'll be up to clinicians to consider what's the primary diagnosis going on in the family, because you will, since they're removing the 5-axis system, you have to list them in order. So that'll be, which kind of goes against the idea of family therapy in that there isn't finger pointing at one person that it's all your fault, but now when I diagnose and bill, I'm going to have to pick one, diagnosis assigned to one person in the system I'm working with and say this is the reason they're coming in.
How does someone obtain a private practice as a psychologist, and does that differ between clinical and counseling? Or does that make sense?
No, that's a good question.
It's a good question. Getting into private practice, I started out getting into a practice that had 4 other clinicians, and just kind of joining in that practice, and we shared expenses. So we basically would just pool our money and pay the bills. Then I went out on my own after about 5 years, I guess, and went out on my own and did my own private practice. It's interesting. I mean, you have to be willing to put yourself out there. You have to be willing to market yourself. My website's done wonders for my private practice. There's a lot of letter writing. I've written letters to primary care physicians, things like that, telling them what I do and what I can do for them. And so marketing yourself is really, really important. So if you're a person that that's not something you like to do, then maybe a private practice already established and joining that might be better. As far as the difference between clinical and counseling, I think when it comes to private practice, you're not going to see a lot of difference. In our program, we have 2 masters. We have 4 masters, but we have a clinical and a counseling master's program. And the biggest differences between those is that when it comes to the clinical degree, it's not as terminal as the counseling degree is. So with a clinical degree, you can go on even at Forest and get a doctorate. With a counseling degree, it's a little more terminal than that. So, did I answer your question?
I was going to say a little more about private
Sure.
practice. When I was in private practice in New York, I worked out of my home. And so I primarily did my advertising word of mouth because I was inviting clients into my home where my husband and my kids and my dogs and cats lived. And so I wanted to be a little bit more careful with who I was having come in my house. And when I came here to Springfield, I've now instead contracted with an already established private practice. And part of the benefit for me there and the choice that I made around that is I do a split fee. So part of every session that I work, a percentage goes to the private practice owner, and they cover my liability insurance for slip and fall, my malpractice liability insurance I carry, and then they also cover my rent and for the space and the front desk person, and they do my billing for insurance, and so that's part of the negotiation of that. But I agree with Dr. Holczer that private practice really, I always think about it, it's kind of like a cup with a hole in the bottom. You got to keep putting them in the top because they come out of the bottom, and part of that is you sell yourself as a product, your marketing, and so that's why it's really important, even as an MFT, to have some niches. So I have some niches in sort of medical family therapy. I also work with LGBTQ couples and families and get a lot of referrals, and mostly word of mouth. Sort of you see someone and they like you and they tell their friends about you. And so niches, even within each of our specialties, you know, developing sort of your area of expertise can be really helpful in marketing and making friends. And then knowing who to refer to. So if someone comes to me with you know, sexual issues, I'm going to send them to Dr. Holczer. So then we develop a referral relationship. And so, you know, that's how you get to know the people you work with.
You almost need a marketing degree.
Right.
No, it's just really difficult. Again, if you think back many years ago, as far as some of my professors when I came in, they were all in private practice. And when you looked at their private practices and what they did and how well they did financially, they could have their own office. But I've seen a trend in the last 15 years where, probably 10 years, that people are joining up together to share the cost, share the billing expenses, overhead. There's not a lot of overhead in our profession as far as, you know, we don't have any fancy equipment that we need. We don't have, you buy testing supplies and things, but boxes of Kleenex. But you really, and I'll emphasize what they've already said, is that niche area that's different. And if you pick up the phone book today and you look, there's 150 psychologists in Springfield. So going through that list and going, if I want to live in Springfield, I need to be doing something that they're not. Otherwise I'm competing with them on everything that they're already doing. So if you can find an area that is different than what everybody else is doing, then you're going to have the opportunities. Maybe even multiple areas, just so that you can stay diverse. But private practice is tough because you have to manage your office and do all the work. If you're doing it alone and by yourself, if you go in like Dr. Brown did, where she joined a practice and she's doing a fee split, you know, or not fee split, but
Fee split.
yeah, fee split. And typically, you know, fee splits are 65-35, 70-30. I've seen it even lower. So you kind of got to negotiate that, but so you can take away a lot of the hassle and just do what you want to do clinically. So
You also want to get on insurance panels, so that's really important. You know, become a preferred provider, because most of you and myself, when I want to see a mental health practitioner, the first thing I'm going to do, or the first thing I recommend to family and friends, is call your insurance and see who's in network and who's going to be a provider, and that's usually where people go. So even in my practice, which has 4 offices and over 27 providers, I'm the only preferred provider on several insurance panels, which is kind of to my benefit, and that takes legwork. That's applications and paperwork, and every 90 days you have to do some reattestations for different, you know, it's just, it is work. And so that's why I'm okay paying my split to someone else to help me with that, so.
But on that same note, when it comes to insurance panels, you know, you'll be on a list of like 20 other providers or something. So to have a website or something like that where people can actually check you out is really helpful.
Social media, I have a lot of colleagues who have Facebook pages, who have Twitter accounts, you know, who do those kind of things to reach out to the public and educate them about who they are so that they know, hey, I'm an option if you need someone, so. We have about 10 more minutes if anybody else has any questions. We want to respect the ending time so you guys can go home.
I don't want to interrupt, but if anybody has any questions about our programs or program requirements, or even applying to grad school in general, we can help you with that as well. Nobody?
Would you recommend like applying your junior year of your bachelor's degree to graduate school, or?
At Forest, you can apply a year ahead of time, and that's pretty typical to most graduate programs. So your senior year, you would be applying that fall for the next fall. And so junior year is the good year to be touring schools, and I always tell people, you know, if you can visit schools, that's the best way to see if it's a good fit for you, to get the feel, meet the faculty, meet current students, take the tour, and just see how you feel on campus.
I've Skyped some interviews, and it just doesn't give me an opportunity to show off Forest, nor does it give the student applying an opportunity to show themselves off to me. I also have a junior in high school, and we're touring some colleges, and boy, it really, I mean, it makes the difference on, you know, she falls in love and falls out of love for, you know, differently than what she thought just online, because it's so one-dimensional. So definitely visit. I mean, when I came on here to interview as a faculty person, I knew the day I was here that this is where I wanted to be. And so I think you need to have sort of that same falling in love moment, so.
How many colleges like this are there across the nation?
That's a good question. Schools of professional
Oh
psychology.
gosh, I knew it one time.
Dig deep.
Round numbers is fine.
Why he's thinking, I mean, like in MFT here in town, there are quite a few other master's programs that specialize in marriage and family therapy, but we're the only accredited in the state of Missouri. You know, so there's more than just what programs are out there. You want to know about their faculty. You want to know about their accreditation. You want to know, you know, answer those important questions and make sure that you're getting your money's worth. So I only went to accredited programs for my degrees. And so it's really important for me then to turn around and have an accredited program and be the director of one.
We're the only applied behavior analysis graduate program in Southwest Missouri. There's, I think, 7 total in the state. So applied behavior analysis, big growing area. There's not a lot of programs around. Some students choose to do their coursework online, but then they have to find their experience and their practicum and everything. And the quality of the education online, it works for some students, but it can vary a whole lot. You don't always know that it's a good program or not. But for behavior analysis, you can look at the BACB.com website, Behavior Analysis Analyst Certification Board, BACB.com, and it has a list of approved university programs and says which certificates are approved and the practicum experience, whether or not it's approved. And Forest has all of them, which makes it one of 2 in the state that has all of the certificates and experience.
There's probably well over 500 professional school options, in that there are some programs like the Chicago School. They may have 10 campuses, so they may be in different states, but they're the same organization.
Or Alliant International
Alliant
in California.
And what it comes to a lot of times, they're all about the same price. And they all have to have the same requirements, because we all have to have the same accreditation, so the same course sequence of classes. So it's where you want to do spend your 4 years. If you want to spend it in California or Southwest Missouri.
Shut up, Brad.
or Colorado, or Chicago, or Florida. Now, and then I would tell the students to go check those programs out, meet with the faculty, see what their specialty areas are, and if it fits. One of the forensic people here, if you followed the Lautner case, she was the psychologist that did all the evaluations and treatment for that case. So testified, and she's on our faculty. So it's kind of hard when you go into the forensic area and not recognize someone like that, if that's your area of interest. So.
You probably also want to ask about money a little bit. Like Dr. Powers said, sometimes they're the same prices, but you want to see what opportunities you would have as a student. So like we have work study, we have fellowship, we have scholarships, we have externships, we have academic awards. So you definitely want to make sure when you're looking at grad school that you're asking those questions. So student loan debt is not fun. I had the opportunity to work my way through my doctorate program, and I'm grateful every day that I'm not getting a bill for that.
Any other questions? Okay, well, thank you so much for your time. Thank all of you for coming. If anybody would like a tour of the building, Brett and